All right, Sagar, what are you looking at?
If there's one thing that COVID baked into me, it's this. I'm never going to trust the scientific establishment again. Before the pandemic, I honestly was pretty trusting. And while the phrase, do your own research, has become a meme, watching the public health authorities outright lie to us about masking and social distancing and pushing policy that makes no sense for 2 years straight has really made it my baseline assumption. They're full of it. But more importantly, COVID, what really happened is I started to understand that that was just the tip of the iceberg. Take the lab leak theory. While yes, the fact that COVID likely leaked from a lab is important in and of itself, the cover-up was way worse. And it showed to us that the scientific establishment was too afraid to admit the truth because of how powerful the National Institute of Health was. If scientists told the truth about gain-of-function research, then it meant that Dr. Fauci and Dr. Collins, two of the people who control billions of dollars in scientific funding, could end their incomes overnight. It showed to me how the science is just like any other discipline, corrupt. Once you start to understand that dynamic involving the NIH, pharmaceutical companies, and more, the medical outcomes in our society start to make a hell of a lot more sense. And furthermore, the internet revolution that has come to disrupt every area of American life is now coming for science, where ruthless scrutiny by those who were not able to critique people before is exposing truths that are genuinely shocking. Let's take the first revelation that has come to light recently. It is a massive indictment of the scientific establishment. Science magazine reports that critical elements of one of the most cited pieces in the history of Alzheimer's research disease may have been purposefully manipulated and outright fraudulent. This paper, published in Nature in 2006, proposed that specific proteins in your body were responsible for cognitive decline. This became one of the baseline assumptions of research and of drug companies, which the government funded to the tune of billions and billions of dollars to try and target for a cure. Well, guess what? Prominent researchers, more than a decade later, who are trying to replicate the results of the study, they can't. In fact, current scrutiny shows that images included in the initial paper have signs of manipulation. So consider the consequences. A potentially false study from 2006 has wasted tens of billions of dollars, with a B, in research. Not only taxpayer dollars, how many well-meaning people who saw parents or loved ones waylaid by Alzheimer's who donated their hard-earned money only for it to be pissed away for nearly a decade? This is a scandal of epic proportions. And frankly, if it's proven that the data was manipulated, these people should be punished for at least fraud. But on a broader level, it shows us the horrific choke points that we have in our system. Why is the NIH the major funder of research in the United States? How did academics get so captured by one single government bureaucracy? And more so, as we saw with COVID, why is it so hard to get these people to admit when they were wrong and not waste money and actually focus on doing the right thing and saving lives? And Alzheimer's is not the only scientific area that we've seen effectively upended overnight in this same week. Another landmark study has just come out involving depression and its causes. A new meta-analysis of massive bodies of scientific evidence finds, quote, no consistent evidence of there being an association between serotonin and depression, or that depression is caused by lowered serotonin activity or concentrations. Researchers reached this conclusion after looking at research that spanned hundreds of thousands of people. Again, this is shocking because the current major intervention against depression are antidepressants, or SSRIs, otherwise known as serotonin reuptake inhibitors. The medical theory behind SSRIs are that chemically intervening to affect serotonin levels in the brain can have a major impact on depression because it was previously thought of as a major cause. And yet now we know that's not true. Now, to be clear, it does appear, though, that SSRIs are still effective against depression, but we have no idea why. Again, why does this matter? Well, the United States is awash in antidepressants. In fact, if you look at per capita usage, we are among the highest in the world, with 110 people per 1,000 on some sort of antidepressant. The only people who even come close are in Iceland. We far outstrip other developed nations. Now, to be clear, Korea, last on the list, they have a sky-high suicide rate. So I'm not saying it's necessarily a bad thing, but it does show you how much our nation has leaned on this specific medication. In fact, a recent disclosure from the CDC found that 1 in 8 Americans over the age of 18 at one point has been prescribed an antidepressant medication. SSRI pushers have long pointed to the faulty research that we just described as to why it's the #1 intervention against depression. Yet, most studies beyond the so-called chemical fix to depression focused on subjects only within 8 to 12 weeks. If you zoom out and you look at people 2 years out post-antidepressant intervention, you see no difference between those who took them and those who did not. Beyond that, what are the risks to screwing with your brain chemistry? Well, here's what we know. There are withdrawal symptoms from SSRIs that can last for weeks or months. The drug can pose major risks for strokes, heart attacks, falls, death, not to mention untold side effects. I want to acknowledge there are millions of people for whom these drugs have benefited massively. But isn't it a bit crazy that the one that so many Americans are on, one that doctors reach for so quickly, that the underlying research backing them is shoddy at best? As with Alzheimer's, it again raises big questions around money. In 2020 alone, the sale of antidepressant drugs grew to $13.5 billion. It is anticipated to keep growing 7% per year from 2021 to 2027. Specific drugs have netted nearly $2 billion in their life cycle of profit so far. So not as much money in exercise or groundbreaking current research, labs on psychedelics or fish oil or a host of other lifestyle interventions or vitamins that are proven to work, not nearly as studied. Both of those instances show that the incentive structure in our current system is not built to keep us healthy at all. They succumb to the same influences that all powerful institutions do: money, corruption, politicization. So while yes, you should listen to your doctors and the scientists, you should also be comfortable asking them why. Because if you don't do it, and if you do it enough times now, you may find out they don't have very good answers. The forces behind what they are saying don't have your interests at heart at all, so you need to dig deeper. I think the depression one is just mind-boggling. Yes. I mean, look, again, I want to acknowledge that there are people, as I've said derogatory things about SSRIs, many people have found them to be useful in your life. But
cable news is ripping us apart, dividing the country, making it impossible to function as a society, and making it impossible to know just what is true and what is false. But the good news is they are failing and they know it.
That is why we're building something new, a new mainstream, a healthier one, something more trustworthy, something that we are going to need in one of the most pivotal times in American history. We are building up here for the midterms, for the upcoming presidential election, but we need your help. So if you can help us out by becoming a premium member today at breakingpoints.com, we're trying to change America for the better and the entire world.
So what are you waiting for, guys? Go to breakingpoints.com and sign up and help us build a new mainstream.